MPP Ross Romano yet again, and this is the second part of our, we don't know how many part series it's going to be sitting with the sitting MPP for a while. We have lots of ground to cover because there were lots of questions that came back. The next biggest thing we heard about when we put our questions out was the mental health and addictions crisis in Sault Ste. Marie. It is all consuming. Outside of COVID right now, which is spiking as we're talking and sitting here, right. It's all consuming, and it's a serious issue. And a lot of people are pointing fingers, and it's just the way, it's the nature of the beast. When people are dying, people start to blame people. One of the people they were starting to blame was you and the provincial government, which is fair because it's hard to see what some of the numbers I'm looking at in front of me that were provided. How much operational dollars have you put into Sault Ste. Marie, at just the Ford government, since 2018?
Well, since 2018, there's been a considerable amount of money. In fact, operational dollars have exceeded $1.6 million. And let's remember, operational, that's year over year over year. And so there's been a considerable amount of money that has been put in capitally as well. There's still a lot more to announce. But I think that it's critical that we understand, very, very critical that we understand. We use words like the continuum of care. And that means that we do not just have services that are confined to a hospital. And when you hear about inpatient services versus outpatient services, prior to 2018, in Sault Ste. Marie, in our community, we didn't have anything other than inpatient services. You had to go to the emergency room to get help. And anybody who had any type of an addiction-related issue was going to the emergency room. And so there was certainly a lot of asks at that time for a treatment center. And there's a lot of words that we're constantly hearing, like treatment, and now we use the word withdrawal management. But ultimately, those two pieces are essentially the same. But what's important to recognize as well, and I know you want to get into some of the specific dollars about that operational as well as capital, but I think it's most critical we remember that when we talk about this continuum of care, treatment or residential withdrawal management is just one very, very, very small piece in that whole continuum of care. And I think the biggest focus that we've had as a government since 2018, and with the nature of the funding that I trust we're going to speak about here today, it's about ensuring that we understand that it's not just that one part of treatment. It's about making sure that you're doing something that's preventative and proactive to being in a position to help people when and where they need it most.
And as I was saying off camera to you, one of the downfalls to me coming into this city just a year ago is I didn't see Sault Ste. Marie before this crisis. I didn't see it when the people tell me it was fragmented and the healthcare was fragmented for the situations that we're seeing now. Looking at some of the numbers and some of the things that I've been able to pull up, what has your government done to, and maybe more importantly, is people past Sault Ste. Marie hearing about the problems that are happening here? Because we live in an isolated little corner of the world, and it seems like what happens in Sault Ste. Marie doesn't always make it to Queen's Park. Is Ministry of Health and them hearing the problems that are happening here and addressing them?
Oh, absolutely. We have to bear in mind that we have 3 members from Northern Ontario who are in cabinet. I think it's fair to say that Northern Ontario has some of the worst rates for mental health and addictions related, opioid related deaths, emergency room visits, and overdoses. It is a fact. The word is very, very clear to our Minister of Health, Christine Elliott, and as well our Associate Minister of Health, Michael Tobolo. They've both been in the Soo. I've had them both here. Michael has been here on a couple of occasions. Christine, our Deputy Premier, has been here as well. I've taken them through so much of what we are dealing with. And that is what led to a lot of the supports that you're seeing here. I think one of the most critical pieces, and I noticed I was actually penning a letter to the mayor earlier today about this. I was with Minister Tobolo just yesterday. He's my seatmate. So I flew in last night from Toronto. By seatmate, we sit next to each other in the House if you ever watch the legislature. And we were chatting about the continuum of care and chatting about the roadmap to wellness and what the plan is. And these are words to everyone, and everybody wants to say, well, how does it impact me? How does this matter to me? And the specific way, and I think this answers your question, is that every single community is unique. We are unique in Sault Ste. Marie, just like Thunder Bay is unique, just like North Bay is unique, and Sudbury, Timmins, and then every other community outside of Northern Ontario. And then if you go into some of our fly-in communities, very, very unique needs there as well. What we need to do is have a very proactive and a preventative type of healthcare for people, for vulnerable people who are suffering through mental health and addictions that is very, very specific to their unique community needs. Right. Because no single, we would always say in the Sioux, and we still say it, I remember before I got involved in politics, we don't want one size fits all. We don't want to be painted with the same brush as Toronto. We want Sault Ste. Marie solutions. We don't want Toronto excuses.
Or even Northern Ontario solutions for that matter.
Certainly.
Like we are unique, and coming from Southern Ontario, coming up here, healthcare in this part of the province is definitely unique, in good ways and in different ways. Like, to me, ever thinking about taking an hour ambulance ride from Wawa to get to the nearest hospital, that doesn't happen where I'm from, where I grew up, and where I spent time. So it's definitely a unique situation. Addictions, mental health is a problem, and we're going to be province-wide. We've talked about this off the record, but it's a province-wide problem, but unique solutions are needed everywhere. What are some of the things that the province has done more specifically to help Sault Ste. Marie's unique issues that we have here?
So locally, I think it's important that we recognize, again, the distinction between what is referred to as an inpatient versus an outpatient service. Before being elected, the services were inpatient, meaning you had to go to the hospital. And I think we need to remember first and foremost that when you get to a hospital, for some people, it might already be too late. There are so many services that we could provide that are outpatient, outside of the hospital. And that was one of the great focuses, was to cover both elements. So if you go back again to 2018, or pre-2018, pre-election, there were no services of a withdrawal management or a treatment center basis. And what we recently announced as a government, there was 2 operational funding announcements that I made with Minister Tabolo and with Minister Elliott just earlier this year for our residential withdrawal management services building. Once upon a time, that was being referred to or called the Level 3 Treatment Center.
That's what everybody in the Sioux still
Right.
wants. Well, what happened to our Level 3? It's coming. It really is. It's actually under construction. I was by there just the other day. I haven't been able to go inside yet, but construction, I can assure you, construction on that building is happening. And I appreciate all the questions on whether it's happening, but yes, the construction on building is happening. The operational funding, go ahead with the number. What were the numbers again? Because again, I lost
the operational funding, there is $343,000 per year. And that is specific to just the operations of the building. That's just the lease, right? That's just to have a lease and to cover a food cost, right, for that facility. Then there's another $155,000 a year that goes to an additional nurse practitioner. Now, bear in mind, there's already funding because those services already exist in the hospital.
Right.
So there are currently 20 beds in the hospital. That's 16 in a 4 split. 16 beds that are there. And then another 4 beds in hospital are for what are called acute care beds.
Right.
If you have other very serious health conditions and are also dealing with mental health and addictions, you would be part of that 20-bed system that is already in place, already funded. The $343,000 plus the $155,000 is in addition to the funding that is already in existence there. That now is going to bring us to a grand total when construction is complete, which we would anticipate opening in and around June or July is the expected time frame at the present time. That would be then a 20-bed facility with an additional 4 beds in the hospital, still the acute care beds.
Right.
So you'd have a net increase in beds of 4 extra beds.
Right.
However, let's remember, these are only inpatient services.
Right.
That is it. This is just hospital. I haven't spoken about all of the other parts that did not even exist at all previous to 2018.
Well,
but if I may just very quickly, very, very briefly, that particular facility, you mentioned construction. They're preparing for the construction, so there is work happening.
Yeah.
The final tender for the actual construction will commence, will go out in around December early January, latest scenario, and then the work on the interior will begin. And while I've announced publicly with Minister Elliott and Minister Tabolo the additional operational money, so that's on top of what is already in existence for the current 20 beds,
Right.
I will still be announcing the capital funding that is yet to come, and everybody will be hearing that news right around the time that we get the tenders finalized.
So we've talked about inpatient. There was a lot. Now we've got the wellness bus. We've got all these other outpatient services that are DSAB's running a wellness bus, and then there's the other outpatient services in the community that you said didn't exist. I can't attest whether they existed or not, so I'm going to take his word for it. He was a sitting councilor at the time, so they didn't exist beforehand. What are some of these services? And I'm looking at like COVID funding for DSAB, which brought in homeless people out of the cold and put them into places so they could be safer and warmer and deal with their mental health. That wasn't used specifically for COVID, like it probably is now, based on what's going on with the Bel Air and other things. But what other funding did you guys provide for out of hospital services?
So that distinction when we talk about inpatient versus outpatient. So there were, previous to 2018, no such thing as there weren't outpatient services. So now what you have in terms of your outpatient services, there's a RAM clinic, right? The RAM clinic, everybody's aware of, it's open Monday to Friday from 9 to 3. Then you also have, in addition to that's your rapid access management clinic. So somebody can walk in the door and get help from someone. They can get some type of prescription, and they can get assistance if they are looking for assistance. So a vulnerable person in need can attend. But what about if you're not available at that time? What about if you're sick outside of that time frame? Well, that happens, obviously. And as opposed to going to an emergency room, again, going to the hospital, you also have what are called now in-home services. In-home services requires you to have a place of your own. So if you're living in your apartment or at home with, whether it be with mom or dad or on your own, and you need assistance, you can call in-home withdrawal management services and a nurse will come see you. That was funded again by our government, and that was to the tune of $120,000 a year to pay for that nurse practitioner to come see you. Now those services are always available. And that is now a service that didn't exist before. And that is a very important withdrawal management service. Now there's a third one, which are called mobile services. You referred to the bus, the community wellness bus. Well, that community wellness bus was funded by the provincial government when we put this COVID funding into place. And there are two buckets that were provided specifically, again, operational funding that were provided to our local DSAB specifically. There was an amount of $343,600 and then another amount of $135,000. And that is to make sure that you had a nurse practitioner again, as well as the other services around, and they were called COVID supports. But again, when we look at those unique needs specific to a community, we recognized as a community like Sault Ste. Marie, COVID then, not so much now, obviously, but COVID then wasn't impacting us nearly as much as the mental health and addictions crisis was. And so those dollars, went to provide operational money towards that bus. Right. DSAB paid for the ambulance. Right. And the province's dollars went towards those operational costs. So now, you mentioned the Bel Air or the Satellite Motel. We know there's some people who are in those places. So that bus is now going directly to locations where they are now providing those services, those outpatient services. So you have your inpatient in the hospital, which absolutely exists. That's one fallacy I hear people say all too often. We don't have any treatment beds. We do. They're at the hospital. It's just that they're currently at the hospital. They used to be downtown on Queen Street. Yep. But they were moved to the hospital and they exist.
And now they're moving to the...
And now they will be moving to the building on Old Garden River Road.
Except for the 4 medical ones. The 4 medical ones, to my understanding, are still staying in the hospital.
The 4 acute care beds will stay in the hospital. Yeah. And they will remain there. And I know that when we talk about this distinction of, but the level 3 was 33 beds at one time. Right. It was going to be 33 beds, but there were, at that time, the concept of outpatient services wasn't even contemplated. Right. Now you have a RAM clinic, you have in-person, in-home, and you have mobile services that are now also providing much needed withdrawal management. And again, I think it's so critical that we appreciate that not everybody can make it to a hospital. and sometimes it's a little too late. And so if we can help people in their own home, in their community, we can maybe prevent them having to make it to the hospital.
Is there anything else outside of that clinic and some of these out of hospital things that is on the radar for the province to help Sault Ste. Marie right now? Has anything come to your attention or to the Ministry of Health from city officials or people inside, whether it be Chad or others, that the city also needs that you've taken forward to the Ministry of Health that you can think of?
Oh, absolutely. Well, I should say though, taken forward, there are, I suppose you can say, irons in the fire, if I can put it that way. But there are also a number of additional pieces. So when we talk about the wraparound services, when we talk about a continuum of care, there is no silver bullet, and I hate to use that term, but there is no one simple solution to resolving this. And that's where at the outset I indicated, for so long now, and I remember dealing with this with my own family. I remember dealing with it as a lawyer in this community. I did a lot of criminal work. We always want to focus on treatment, but treatment is one small piece of the overall continuum,
Prevention.
right? We need prevention. We need education. We need something that is proactive. We need wraparound supports. So do we only worry about giving somebody treatment when they are in need, when they are at a point of an overdose? What about all the other forms? So what we've done is we've provided through Algoma Family Services, there is $80,800 that has already been advanced. I announced that earlier last year. And again, operational year-over-year funding. These are all dollars that continue over year for child and youth counseling services. We provided through the Algoma District School Board, again, operational money for students at the ADSB, and it was another $224,142. We provided through the Huron Superior Catholic District School Board another $211,098. Again, year-over-year funding. Then we have at the university level, Algoma University receives $146,823 a year in funding, and Sault College receives $149,252
And this is all for mental health and
this is for mental health and addictions counseling services from the level of your primary, secondary, and post-secondary levels of education. Because do we only want to worry about someone when they end up in a hospital, or do we want to make sure that they get help before they wind up there?
I think coming from somebody who has a background in being addicted, as I've admitted to in multiple times, having that available to a 15-year-old who's maybe just tried something once and is starting to go down that rabbit hole, I want everybody out there to understand that these do exist. Like, go to your counselors, go speak with them. They can get you the help before you end up like, and I hate to say it, some of the people you see, the videos you see that spread all over social media of these individuals downtown who are desperate for help and don't know where to turn. If you have, and we will put something on this to that extent, but if you have an addiction history, you feel like you're struggling, there are some numbers you can reach out to, and there are supports at your schools, through your school boards, to talk to them. And I'm sure you can also call Ross's office, and he can point you, or somebody at Ross's office can point you in directions for places to get help too.
There was one other significant one we funded through Algoma Family Services, another announcement I made earlier this year, which was for human trafficking.
Right.
And now when you look at through Algoma Family Services, all of the supports that now exist there for those who are dealing with issues around human trafficking, which is absolutely a tremendous problem. And again, you're talking about people who are absolutely in need of help, counseling. If you don't get those services at the first possible opportunity, that is when you may end up turning to addictions. And once you are addicted to that substance, once again, we still want to make sure that those inpatient services are there. The hospital services are critical and important. The treatment services are critical and important. But we still need to counsel people. We need preventative and proactive care. We need wraparound supports. And then there's more to it. We're not even done there. There's housing. We look at all the additional funding that our province has poured into the DSABs locally to make sure that there are good, strong housing initiatives. Great program we did with Councillor Dufour. I thought it was an outstanding idea. I brought Minister Clark to Sault Ste. Marie to see it. We funded a $900,000 program, and we already have 2 houses that have been built by workers.
That's how much to... That's the homeless, or I forget what he called it exactly off the top of my head. But
I don't recall the name either, but an outstanding program. And I was with him at a house earlier this year, presenting a family with a home. And that was such a smart idea. It's cyclical money. The money was invested. It created the starting point. And now that can be a reoccurring, the pot continues to build to be able to give people a home. All the affordable home ownership things that we are doing to create affordable housing is important because, again, and having dealt with this as a lawyer for so long, someone who gets out of a treatment program, what about if they don't have a home to go to?
Right.
What are they going to do now?
Well, and that brings back the argument that's always there. You go to treatment, you spend 28 days there, you leave treatment, you go back to where you left before you went into treatment, to back to what you know, and it, again, cyclical. Unfortunately, that's a reality in multiple communities.
You need housing, right? You need housing. You need to be able to have a chance at a job.
And community supports.
You need the community supports to be able to stay healthy once you get out, because as everybody out there knows, anybody who's ever paid any attention to a 12-step program, all of us have been impacted, at least know somebody who's been impacted by mental health and addictions, knows that you're not good when you don't just walk out of the door of a treatment center and poof, you're done. It's you're fixed. Yeah. No, it's something that you have to continually work at, and you need all of those wraparound supports and community supports to help you. Housing is important, a job is important, so all those pieces contribute.
One of the viewers did ask, and I'm going to ask you, but I'm pretty sure I know the answer. Is there any plans to privatize any of this addictions and mental health care, like to bring in private partners to help in situations like this, where maybe the province isn't able to fund completely what's going on?
Well, there already exist private treatment centers in the province. There are private centers out there, but no, it's not. The province does not. The province would never privatize mental health and addictions care, just like healthcare. And it was a conservative government a long time ago that created healthcare, publicly funded healthcare. There is absolutely never going to be a situation where we do not have a publicly funded healthcare system. And certainly that is part of care. Mental health is health, right? Mental health, and the more and more we learn about mental health, the greater we realize the problem is. And one of the hardest parts about mental health, I think, if I may, there's such a stigma that applies to it, that is attached to it. And people are very, very scared to acknowledge they have a problem. I mean, that's one of the most beautiful things, that when you look at something like Bell Let's Talk, what's that about? It's about being able to communicate to everyone that if you have something wrong, if you're feeling down, you need to talk to somebody. You're not alone. Talk to somebody. And the more we learn, the more the funding is going to have to continue to increase, because we're scratching the surface.
I think, and this was at the rally, and I will give AMH a huge shout out for the rally and having people come speak. One of the things that was brought forward and really hit home to me, because I do suffer from mental health, is if you go to the hospital with a heart attack, you're in Toronto getting heart surgery in 6 hours or whatever it happens to be from here. It's stranger from here, I'm not 100% sure. But if you go to the hospital right now and you have a mental health issue, the time frames are longer. You may want the help now, but it's not there. And like you said, we're just scratching the surface of this issue. And as we move forward out of COVID and everything else, those time frames need to be shortened. Is there anything on the provinces, like we're building beds, we're building treatment facilities, we're building whatever we want to call them. Is there anything that's going to make these, that you're aware of, that's going to make these time frames shorter?
I think, if I may reference it this way, and I'm not sure if you'll recall, but our government spoke of the Mental Health and Addictions Center of Excellence. And centers of excellence are areas where we're trying to focus in on how to solve a problem. One of the greatest problems that we are facing as a society today, certainly within North America, and I've spoken to counterparts in foreign jurisdictions. I've met with ministers in Germany, ministers in France. I actually met the premier of Auvergne, France. I had lunch with him one day. Some places of the world aren't dealing with addictions or opioids the way we are in North America, but certainly it is rampant here. one of the great struggles, and I noticed this as the Minister of Colleges and Universities, and I was responsible for research and innovation when I was there. And in the research portfolio, as a small example, we had over $70 million a year that went to cancer research. Out of a total bucket of $327 million of research money in the province of Ontario, $72 million went to cancer research alone. When you contextualize that, and then I looked at research in the area of mental health and addictions, I started to learn that throughout the entire continent, there is no one dedicated research facility just on mental health and addictions. So as we looked deeper and recognized that as a country, being Canada, that has such a struggle with our history of Indigenous relations, and Indigenous relations, today we speak of truth and reconciliation, we speak of the residential school period. But the difficulty in terms of our country's history with Indigenous relations started even before residential school, right?
Yes, most definitely.
And so that began a long time ago. And those, when we look at specifically so many of the mental health and addiction struggles that we have in Ontario, and especially in Northern Ontario, and you look at our Indigenous populations, I started thinking to myself then, we have a very, very interesting opportunity, I think, in Sault Ste. Marie. And we have, in the entire province of Ontario, the only residential school that you can walk into, and that's at Algoma University, and that's Shingwak Hall. And it was only closed in the 1970s. Yeah. When I moved towards the, I advocated tooth and nail to try to get funding for the Mukwawakaigan, which is the National Reconciliation Center that is now going to be at Shingwak Hall. And again, the only residential school in the entire province of Ontario that you can walk into that's not boarded up. And you can go into that school and you can feel what has existed in those hallways for over 100 years. The point of where I want to go, and people have heard me talk about this, I brought together when I first became Minister of Colleges and Universities, a group of 5. And it was Algoma University, and it was Sault College, and it was Sault Area Hospital, it was SKG Group, our Indigenous Institute, and the Northern Ontario School of Medicine. And I put that group together. They are currently waiting the results of a feasibility study to create the first in the entire continent exclusive facility that would be Ontario's Mental Health and Addictions Research and Training Institute that will focus on research in the area of mental health and addictions and training in the area of mental health and addictions so that we can learn more. To get to your point of what you're saying, we still are just learning so much. We need to learn more because for every individual out there, there's different, we already know the research that we do have in mental health. A drug is going to react differently from one person to another. Some people are more susceptible to an addiction than another. Some people are more susceptible, some people will not respond to certain medications like a Suboxone the same way other people will. So we need more research because this is still relatively new. And to the point I started with on this, we now fund the Cancer Institute with $72 million a year. And look at the progress we've made in some of these areas. You look at the progress we've made in so many different areas. Just look at COVID even.
I want you to take a look into that camera. I can guarantee you right now there are parents and there are individuals who have lost people to addictions and mental health. And I want you, if you were, and people that are probably addicted are watching this, could be watching this too. If you had one message for these individuals, I would like you to share that with them now.
My message is don't give up hope. I absolutely, and we as a government are working towards doing everything we possibly can to help. I think it's so important to know that there is help there, and you have incredible people in this community who are working hard, tirelessly every single day. People at the hospital, all of our medical staff, our frontline heroes, they are working tirelessly, and we all are, to try to help. Don't be afraid to access those services and know that we will not stop until we will continue to advocate for everything that you're going to be able to need. But please know that there's always somebody out there, and don't be afraid to reach out to anyone for help, and certainly you need to know that you're not alone in this, and that it's important just to talk to someone, because I think anybody who is suffering through any type of a mental health and addictions issue needs to know that the first step is talking to someone. And I think that's one of the most critical pieces that we all have to remember.
And I will reiterate exactly what he just said. Reach out to me, reach out to lots of people who have come out in the community and said they've struggled. We are there to listen. Somebody will listen. So with that, thank you for joining me, Ross. And we'll join him. He'll join us again here for another couple of segments going down the road.